Paget here. Welcome to my channel. As always, if you're new here, I want you to have a look around, check out the playlists, see what interests you, follow those playlists. I try and group everything as logically as possible. So you've got back pain, you've got scoliosis, you've got lifestyle medicine. Those are the three things that I really specialize in. Today, however, I want to talk to you about something very serious, the scourge of the modern society, the chair. This has been likened to smoking. Sitting is the new smoking, and I want to delve into a little bit of why that is and what we can do about it. All right, so what is the problem with sitting down all day? Well, the thing is, most of us get up. This is most of us who go to work. We get up, we get in a car or on some sort of form of transport and we sit. Then we go to work, we sit. Then we come back, we go back on that transport, we sit, and then we have dinner and probably sit. And I myself used to do this. I used to have a 45-minute drive to go to work. The difference is when I worked, I was working standing up as an osteopath, but then I would come back in that 45-minute drive and sit, and then I would sit and watch TV, or sit and be with my kids, or sit and watch and have dinner. So sitting is definitely a big part of most people's days. But sitting has been shown to increase things like bowel cancer. It's been shown to increase problems with heart disease, and in women, it's been shown to increase breast cancer. So there is a problem with the act of sitting, but it's actually being still that is the problem. More importantly for me and for the clients I see, it's a problem with tight hips and back pain. And that's where I want to really show you what you can do when you sit. Okay, so I want you to imagine that I'm at work. So I have a chair and I have my work set up here. This angle in the hips is 90 degrees, and it will shorten these muscles at the front of the thigh called the hip flexors. And one of those muscles in particular, the psoas, is a deep flexor, which means it goes from this bone here, the femur, and it attaches to my vertebrae, to my spine, right through like this. Now, when that thing gets tight, when I stand up, imagine it's shortened here, it's tight. When I stand up, it really pulls and pulls and pulls and pulls in order to get my hip straight, but it will pull my spine into extension and keep my hip flexed here. But really I want to be able to move my pelvis and have hip extension. So what can I do during the day to prevent that from happening? Well, there's a few things. First thing is this. I can simply take a pillow, put that on the ground down here somewhere, and try and keep my hip completely straight. So I can still look at my keyboard, answer my phone, do whatever I need, but I can actually keep one leg straight or even into extension. This position is fantastic. Sure, I can't hold this for very long, but I don't want to hold it for very long. I want to hold it for 10 or 15 minutes and then simply shift to the other side. Obviously my keyboard will be over here, so I would move the chair. Now, some people say they can't do this because of the armrests. Well, you can, and I've just shown you how to do that with armrests, or you can get a chair without armrests to make it even easier. So we're going to keep the hip nice and open here. We're going to keep the pelvis moving, because it's not necessarily the sitting position like this that's the problem. It's the time we spend in this position. So if we constantly move the hips, they won't get a chance to tighten up. The muscles won't get a chance to adapt to this position. So that's taking the leg and extending it, keeping the muscles long. But also we can actually say to the muscles, well, you know what, we're going to make it a little bit shorter. So here I am at the desk still. I can just take a desk stool, and a floor stool, sorry, and I can put my leg underneath it. Now this increases the angle of my hip joint, and I can work away here. Now why would I want to increase the angle of my hip joint, essentially making those muscles even shorter? Well, if I take them into this position and shorten them up, and then 15 minutes later I take them into this long position, I'm actually creating a huge amount of mobility in my hip joint. And then if I vary the angle, so we have it in front of me here, or I push the stool out to the side here, and I have a slightly wider angle, now I'm getting different stretches into different muscles. So I'm actually getting the opposite of what sitting normally does, which tighten you up, I'm actually getting more mobile. I'm treating my office day as a type of almost yoga therapy. And at the end of the day, I'm going to end up with more flexible and mobile hips, and I haven't even stood up, which is amazing. Now, when we want to talk about standing up, we can do that as well. But standing up has its own problems. There's a reason we actually invented the chair and started sitting down in the first place. But if we cycle between sitting, keeping the hip joint straight, keeping the hip joint more flexed, and standing, and we keep that cycle going through the day, our productivity should not go down, but our risk of mortality, our risk of cancer, heart disease, and all those sort of things will actually go down, and our back pain and hip flexibility, well, our back pain will get less, but our hip flexibility will increase. And we can potentially, and it is a jump here, potentially we're going to be avoiding things like hip and knee arthritis in the future because we're going to have a more mobile hip. So this is what I recommend to my clients when they are tied to a desk job. They don't have any choice apart from to be in front of their desk. But I show them how to optimize that work position by moving their hips in multiple directions and actually ending up having a benefit of increased hip flexibility from this approach. If you like this information here, don't forget to press like on this video and subscribe down there somewhere. Like and subscribe, please, because the more likes I get, the more subscriptions I get, the more videos I can make. But also, if you know someone who is complaining about tight hips and lower back pain at work, send them this video. Give them the gift of more flexibility, because this can really change a person's life if they think of their work life or they think of their desk life differently, and they can increase the mobility of their hips. If you like this, also there's different ways to follow me, because I have an Instagram channel where I actually give little shorter snippets of information like this and share a little bit about how I put things in my life together. So Instagram is ed.paget. I also have a website, edpaget.com, where I share a ton of information through my blog about all things scoliosis, back pain related, and lifestyle medicine related. So go on, check those out, and I will see you in the next video.